Today's online course is part one of a four-part series on how to use the CMS Hospital Compare. It's a tool for you to compare different providers like hospitals, inpatient rehab, home health, nursing homes. This will help you identify what is right for you and your loved one. In part one, we're going to talk about hospitals. So let me share my screen. And I'm going to go to, well, I'm already in it, but what you would do is you would go to Hospital Compare, and it will pull up. It's a government website, Medicare, is the CMS Medicare, and you go into this, find hospitals near me. Now, that's why this is a four-part series, because when you open this up, it talks about every facility, doctors, home health. So that's why I'm going to do this over time, because today we're going to focus on hospitals. So that's what's highlighted. I've already got my location in. You hit search. So when you go in here, you can obviously filter things by different distance or however you want to do it. So I'm going to go in St. Vincent's, and here's a snapshot of what you're going to see. Like this place, Brookwood, doesn't have a great overall rating. I'm more interested, me personally. I mean, there's patient surveys on their experience. The most important to me is their quality of care you're getting. So this just lets you know, you can scroll down and look at all of them. But for this example, I'm going to go to just St. Vincent's because it's the top. So when you get in here, it'll tell you about ratings, quality, details of the hospital, affiliated doctors, and location. I focus on these top two. So like we saw at the beginning, you can see their overall ratings. But if you open it, it will tell you their mortality. And I'm going to have to put on my readers. But you open this up and it'll tell you more information about that: readmissions, patient experience, timely care. So it also coincides with the online course I did last time from Leapfrog Group. They do the same thing. So same thing with overall patient ratings. You can open it up and get more information. I really focus on quality. And y'all, there's so much in here, like I said, I say it on all my courses. If you ever want me to do more extensive online courses that you would like to participate in, please comment below, because I have done online courses before. It's just more of a 30-45 minute class because there's so much information in healthcare. So if you go into each of these, so say we're going to do timely care, this lets you know, like, sepsis, hospital acquired infection. This hospital doesn't do as well as the national average. I mean, you can look at heart attack care. If the information is not available, that means they are not reporting it. So sometimes you need to ask the hospital, why aren't you reporting it? You can even look up the emergency department and who left before being seen, the volume, how many patients they see annually, and how long you're there. So this is a ton of stuff. Like I said, in these short little classes, I don't go over this. You can look up complication rates, death rates, infection rates, you know, for COPT, heart attack. So it's just a wealth of information. Get familiar with it. Because these are tools that can save your life and prevent medical errors or harm occurring to you or your loved ones. So again, please make sure you subscribe, you like, you share, comment. You like it, you don't like it, you want more, but that's not how I'm going to know what you need, because what I'm trying to do here is to inform you. So thank you, and I hope you have a great day.